friends. In this week of atrial fibrillation, we the cardiologists concentrate on problems related to atrial fibrillation. Atrial fibrillation is a cardiac disorder in which heart rate is very fast and rhythm is very irregular. Irregular heartbeat is known as atrial fibrillation. It is commonly seen in very elderly people, but in our country, even young hypertensive, young patients with rheumatic heart disease, they also suffer from atrial fibrillation. Large number of patients with chronic high blood pressure, hyperthyroidism, chronic diabetes, and ischemic heart disease patients, as well as the conditions like hypertrophic cardiomyopathy, dilated cardiomyopathy, all these patients are at risk of developing atrial fibrillation. Atrial fibrillation, in which there is a very fast heart rate, the heart gets fatigued and they develop heart failure. They develop symptoms like palpitation, fatigue, easy fatigability, exertional dyspnea or breathlessness. Some of these patients also develop a clot formation in the atrium, which then gets dislodged and goes into the systemic circulation and can lead to conditions like stroke or paralysis. This is very difficult situation. To prevent the stroke, it is mandatory that all patients of heart diseases must undergo regular checkup and to detect the atrial fibrillation at a very early stage. It's very easy to diagnose atrial fibrillation. Taking simple ECG can detect most of the cases of atrial fibrillation. Those cases of intermittent atrial fibrillation may require 24-hour ECG or Holter monitoring. Once it is diagnosed, atrial fibrillation, it becomes mandatory for all cardiologists to treat the patient with anticoagulants unless they are contraindicated. Oral anticoagulants given for a lifetime can prevent the atrial fibrillation going to stroke situation. Those who already develop a stroke, they also need treatment with anticoagulants, as well as sometimes they have to be treated with heparin and other drugs. So I request all my friends, doctors, to concentrate in early detection of atrial fibrillation. And also I request all my long-standing friends, patients, to have a regular checkup for early detection of atrial fibrillation, and if it is present, it should be properly treated by a specialist cardiologist. Thank you very much for listening. Thank you very much.